Namaste Vidya. हमेशा खुश रहो Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's clinical lecture, we are going to discuss about the psychiatric assessment of the mental state examination, that is MSE, of a patient, of psychiatric patient who is coming to us. So we are doing the psychiatric assessment of the mental state examination. Mental examination format includes the following things. Number one, the general appearance and behavior of the patient who is coming to you. We will check for the general appearance of the patient, the attitude towards his examiner, the comprehension, the gait and posture of the patient, his motor activity, the social manner and rapport. There are 8 things that we need to check in the patient. We first of all need to check the general appearance and behavior of the patient. Then we will check for the speech, motor and effect, thought, perception and abnormal beliefs, insight and judgment. So, in general appearance, we are checking the general appearance, attitude towards the examiner, comprehension, gait and posture, motor activity, social manner, and rapport. In the speech, we are going to check about the rate and quality of the speech, the volume and tone of the patient, flow and the rhythm. Rate and quality of the speech, volume and tone, flow and rhythm. Then we will check the mood and its effect on the patient. We will also check the thought of the patient, the stream and the form, and then content. In the next step, we are going to check for the perception and abnormal beliefs by the patient. We will check what are the different perceptions, whether is there any kind of illusion, delusion, or hallucinations. Then we will check for the cognition, that is higher mental functions of the patient, to check for the consciousness level, orientation, attention, concentration level of the patient, his memory and his intelligence, and also the abstract thinking. So in cognition, we will be checking about the consciousness, the orientation, the attention of the patient, concentration, memory, intelligence, and abstract thinking. Then we will be checking the insight of the patient, what he thinks from his insight and his judgment ability. In the general appearance, we are going to check for the physique and body habits of the patient, his build, his physical appearance, approximate height, weight, and his appearance. We will be checking for the looks, anxious and depressed on the patient, his physical health, his grooming, hygiene, and self-care. How is the dressing sense? Is it adequate, appropriate, or it is full with abnormalities? We will also be checking for the facies, that is non-verbal expression of mood, effeminate or masculine. Then we will check for the attitude towards the examiner, whether he is cooperation, guardedness, evasiveness, hostility, combativeness, or naughtiness. We will also be checking for the attentiveness of the patient, and it appears interested, disinterested, or apathetic. Any ingrating behavior of the patient or perplexity. In the next step, we will be checking for the comprehension of the patient, whether the comprehension is intact or impaired, partially or fully impaired. The next, we will be checking for the gait and posture of the patient, whether the gait is normal or abnormal, the way he is sitting, he is standing, walking, or lying. Then next, we will be checking for the motor activity of the patient, whether it is increased or decreased. Is there any excitement or stupor? Any abnormal involuntary movements like tics, tremors, or akathisia? Any restlessness if he is ill at ease. We will also be checking for the catatonic signs like mannerism, stereotype posturing, waxy flexibility, negativism, ambitancy, automatic obedience, stupor, echopraxia, forced gasping. We will also be checking about the conversion and dissociative signs, pseudo-seizures, possession states. Any social withdrawal or autism has to be checked for. His compulsive act that he has committed in past, the rituals or habits, example nail biting, etc. and the reaction time has to be noted down. The social manner and non-verbal behavior has to be checked for increased, decreased, or inappropriate behavior of the patient. His eye contact, that is, gaze, aversion, staring vacancy, staring at the examiner, hesitancy, eye contact, or normal eye contact has to be checked for. His report, whether a working or empathetic relationship can be established with the patient, should be mentioned. Any hallucinatory behavior, smiling or crying without reason, muttering and talking to self, non-speech, social speech, and odd gesturing in response to auditory or visual hallucination has to be checked. So this was all about the MSE examination of the case of psychiatric disorder. In the next lecture, we are going to discuss about psychiatric assessment, cognitive neuropsychiatric assessment. This session is powered by Digital Version 2.0 JYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture.